morning, Fun and Road Surgery, Mandy speaking. How can I help?
Do you self-harm?
I've quite a history of that.
Okay, like what?
Cut my wrists, so trying to kill myself several times.
I want a new pair of legs.
You are a candidate for a new pair of legs if you want a new pair of legs.
You might feel a bit pushed there.
Oh.
Sorry, it might hurt a bit.
Oh, my God. I feel my fingers tingling.
The trouble is, Dr. Shree, I can put up with the hard skin, I can put up with the cracking, everything. It's the itching. It's unbearable. It's so bad.
Okay. How's your mood?
All up and down.
Recently, has it been more up or more down?
I get upset very quickly.
What I'd like to do is examine the back passage. Is that going to be okay?
Well, it's clean enough. I mean,
Yeah.
I'll give it a good wipe.
Yeah, okay.
Morning.
Well, it is morning, but I don't know what's good about it.
Peter Fidgin. You want to come down? Yeah, how are you? Right, Dr. Bolger wants to see you after me.
So what do I do? Just go and wait in there?
Yeah, and I'll tell her that I finished with you, and then she
Okay,
will...
yeah. You finished for me?
Yeah, I've had enough of
It's
you.
all
Throw
over.
you out, yeah. How are you anyway, my love?
Not bad. I've had a bit of time in hospital.
Oh, you haven't?
I got an infection and I couldn't pass water for a day.
Oh, God.
I was in there all night, A&E. Treatment was excellent, as usual.
I don't know, I was a little bit low at 1.8.
When you say low, that's too thick, is it?
Too thick, yeah.
Okay, yeah.
So I want you to go on 5 milligrams every day.
Every day?
Yeah, and I'll see you in 2 weeks.
2 weeks, is it?
2 weeks, yeah.
Okay, that's
That
fine.
one's that one, I have that one, you have that, so
one.
that.
Here we go.
And you take a seat and I'll tell Dr. Bolger that
I'm ready.
You're ready and raring to go.
Raring to go. Okay. Thanks a lot.
Bye.
Bye.
Yeah, that would be nice, yeah. Okay.
There's nothing to worry about. There's nothing to worry about, lovely.
Feel better.
All right, tell me, what's wrong with this little boy?
He's been ill since Sunday night. He's been having really high temperature, burning up to touch. He's hardly drinking anything. He hasn't eaten in 72 hours. And he's come up with...
Yeah, has he got it anywhere else?
down his neck.
Has he got it on his tummy or anything?
No, it's okay.
Oh, should we going to listen to your TikTok? It's all right, I'm just going to listen to your TikTok, darling. This doesn't hurt. This is just... Listen, I can hear your TikTok now. It's going TikTok, TikTok, TikTok. Good boy.
Mummy, I don't want it.
You've been very brave.
No, I don't want it.
Now, we're just going to look for some strawberries in your ears. No, there isn't one on that side. Is there one on the other side? Oh, it's all right, baby. It's all right. Let's have a look. Let's have a look. You're ever so good. Nah, no strawberries. Well, that's no good, is it?
See?
I think there might be one in your throat.
Mummy,
You've got to go, ah.
no, I don't want it.
Listen, look, watch me do this.
Right, open your mouth, look, copy mummy. Ah.
Mummy, I don't want it.
Okay, I'm going to have to hold you then.
Ready, Mum?
Mummy, I don't want
Good
it.
boy, good darling. I know. Oh, yeah, you've got rip-roaring tonsillitis, young man.
Mummy, I
He's got
don't
what?
want
He's got what?
Tonsillitis.
He's never had that.
Can you give him some penicillin? 1 spoon 4 times a day for 10 days to kill this particular bug, OK? For the next 48 hours, regular Calpol, ibuprofen, keep his temperature down while the antibiotic starts to work.
See, look, they give you some medicine, make you feel better.
All finished now.
You say thank you.
You were a very good boy.
Okay. Should we go take this to the pharmacy? Come on then.
Bye-bye.
Thank you.
Right, take care.
Really raining.
Yeah, it's not very nice out there. It's going to be horrible at the weekend again.
You like that?
Come on, MC down there. How you doing, sir? You all right?
Not too bad yourself?
Yeah, not too bad. So this cough...
Yeah, I'm no doctor, but
Yes.
I think it might be on a bit of a chest infection, somewhat.
So how long's it been going on for?
3 or 4 months now. But
3 or 4 months? OK.
in the last 2 weeks, it's just gradually gotten really bad.
OK.
I'm scared because I coughed up a lot of blood, really.
OK.
And I started getting nosebleeds, and I don't normally get that.
And like bright red blood or kind of dark, or how does it look?
As in, it would be sometimes dripping out my nose.
So, but when you're coughing, I mean?
Oh, it would be in the phlegm.
Do you smoke?
I do, yeah.
How many a day?
Too many.
Too many. Yeah, that's the right answer, isn't it?
Yeah, that's it.
But how many? What you roll-ups? Are you buying them?
Roll-ups, yeah. I'd have about... I mean, at work, I'd have 3 roll-ups. And then when I get home in the evening, I do smoke a bit of weed, I'll be honest.
So, I mean, just independent of all this, I would want you to stop smoking anyway. I mean, there's lots of reasons to do so. In terms of the here and now, what's going on, so I'd like to check your temperature, have a look in your throat, have a listen to your chest, and then we'll see what's what. Yeah?
I don't know if it contributes to it, but there's been a lot of stress recently as well.
OK.
Might have something to do with it.
Stress with work at home?
Both, to be honest. My job's only guaranteed for 9 months.
Oh, right, OK, fine.
And also at home, things are really bad at the minute. I moved over here 2 years ago, and ever since I haven't been able to find accommodation. I'm sleeping on a couch for 2 years. I don't have any friends, and as far as getting a missus or something like that, you know, it's a lot harder when you haven't got the things to do it.
Yeah. You haven't got your own space, basically, right?
That's it, yeah.
I feel absolutely wretched. I've got this, well, it's a bad cough.
Oh dear!
I have this really bad cough, and when I start coughing, I can't even breathe.
I've caught a serious case of man flu.
Okay.
Is it a dry cough or does it sound chesty?
Man, do cough, honey?
A bit chesty. Oh, gosh, sorry.
Last night, her chest was really crackly.
Sure.
It sounded like Cocoa Pops.
Oh, goodness.
Oh, help me, help me, help me.
Do you feel like you're depressed? Do you feel...
Yeah, I won't lie. I've been depressed for 2 years, but I'm one of them people, I won't pay someone to listen to it, you know. My mum always says, go to get help and stuff. I don't agree with it.
In what way? Like, why?
I don't think it will help.
You don't think what would help, though?
Like talking to a counsellor.
OK, right. So, like, talking therapies and... OK. Yeah. Do you sort of self-harming or anything like that?
I've quite a history of that.
OK, like what?
Cutting my wrists, cutting just shapes and names into my body.
OK.
So trying to kill myself several times.
Have you had thoughts like that since you've been here?
Yeah, quite a lot.
Have you done anything with those?
No, I was self-harmed when I first got here, but I taught myself out of that.
Cutting? Or?
Yeah, cutting.
OK. It sounds like, even though, you know, you might think that the talking therapies and stuff isn't going to help you, I don't know, I think it might be useful. And the thing is, you've got nothing to lose by trying, do you know what I mean? Yeah. Unless it's a time issue. But the services that we have locally, they'll even do stuff like internet modules or telephone counselling for people who are struggling to make it to appointments because of work and all that sort of stuff.
I don't know.
Let me leave you with that thought, right? It's a self-referral system, no pressure. I'll give you the telephone number for it. Have a think about what I'm saying, and then if you change your mind, you change your mind. Have you ever been on medication?
For that?
Yeah.
No, I haven't. I've never spoken to a GP about it, to be honest.
Do you want to talk about medication, or...?
I'm quite happy just to when I get home in the evening, just have my dinner and have a smoke and forget about it.
The thing about cannabis, it can cause you more problems, and it might be keeping you stuck with that kind of depressed mood more than you realise, even though that initial effect is to help you feel relaxed.
Yeah.
Does that make sense? So I'll give you the details for the talking therapies. Think about the medication if you want to know more about it. And why don't I book you back with me, say, 2-3 weeks down the line, and it just gives you a bit of headspace to think about what we've had a chat about, and then you can come back and just tell me how you feel about it. Does that sound all right?
It might not be bad, yeah.
Okay. So let me have a look at your chest and stuff first.
Yeah, of course.
Come on in. Have a seat. I'm doing all right. How are you doing?
Well, if you can understand this one, or just looking at it.
Is it confusing you?
These are the last few morning ones. That I've put AM instead of PM on some of them. I can't, but I've got to do it better than that.
If anything, these are running a bit low, aren't they?
They are, yeah.
You're going to 3s too often. Now, every so often, you will get an odd one that's a little bit high.
Well, it makes me... I can eat more biscuits then, can't I?
No, you can't.
Hey?
No, you can't.
Can't you? I thought that knocked it up a bit.
What I mean is, though, that it's better to get rid of the low readings.
Of course, yeah.
Yeah? So I think that you're having a little bit too much insulin now in the evenings. So let's drop that back down to 24, yeah?
OK.
And the trouble with doing your sugar after you've eaten is that the meal mucks up the sugar reading. So the routine when you're doing a sugar reading in the evening is you do your reading, then you have your dinner, then you have your insulin.
OK, that's fine, yeah.
OK?
That's good.
We're going to do this for another couple of weeks.
OK.
Good.
Thanks a lot, Doc. I'm sorry about all this.
Don't be silly.
I'm too busy picking horses out of the paper.
And are you winning?
Yeah, I am lately, yeah.
Good.
Not much. Something to do, you know.
Keeps you off the streets.
Keeps you off the streets. Thanks very much.
You take care, yeah?
OK, yeah.
How long's your flight? I'm not flying. I'm sailing. From? Southampton. Oh, wow. Yeah. Did you not realise that? No. Yeah, I'm sailing from Southampton. I've got 8 days straight sailing. Your mouth. I'll be well relaxed by the time I get there. Yeah, you will. Hi, can I help?
Deep breath in now. There we go. Okay, have a seat again. I'm not as worried about the blood that you're coughing up or the nosebleeds, right? So what I'd like to do is give you a course of antibiotics, because I think there might be something going on in the chest, OK? If you have your course of antibiotics and everything goes back to normal, then I'm not so worried about this. But if you finish those antibiotics and you're still coughing up blood or you're still having problems, then we'll have to look at it again and then think about things like chest x-rays and stuff like that.
Thanks for that. That's great, because that's a bit of relief off my chest. I hate bleeding.
Yeah. OK, so that's 2 things for the appointment. One is just to have a think about the talking therapies. Let me know what you've made of this if you've decided to do something with it. At that time, you can let me know if you want to know more about medication and sort of how you're coping and stuff like that. And then we'll see how you're doing. All right.
Well, thank you so much.
No problem. You're welcome.
I'll look at your name.
Dr. Jiwanji. It's easier if you see it spelt.
Oh, yeah.
There you go. Although if you tell them the one at the hat at the front, they usually know who you're talking about.
Thank you so much for your help.
You're welcome.
It's also quite nice to chat to someone about that as well.
It's good you say that, because that's why I want you to think about that.
That's it, yeah, that's it.
Because it might actually be quite useful, you know?
Sometimes you get lost in it when you get home and you don't think about doing anything about it.
And also, especially the way you describe it, you could be quite isolated in that, and you don't have to feel that way, you know? So there are people out there who know how to help you with that sort of stuff, so...
Thank you. Thanks again.
No problem. Take care.
And,
no problem.
Have a good day.
Yeah, you too. See you.
Cheers.
Bye.
Thank you.
Hello, come and see. We meet again. How are things with you?
A bit up and down.
Okay.
Up and down. But now the other hand is started.
Okay.
So
let's do the worst hand today.
Yeah, this is the worst one. I was reading on the side effects because I'm really sort of, you know, paranoid when it comes on to taking new things. So I went and I read a lot on it last night, and it's fine.
Okay.
Yes, I feel a bit more comfortable this morning. This is one of the more common forms of treatment, isn't it?
Some people have a marvelous improvement, up to 50-50 actually.
Okay.
So 50% of patients feel better for the next 6 months. And rest of the 50% come back in 2 weeks' time and say, no, it hasn't done anything.
Oh, that's not, I don't fall in that category.
Hopefully not. So there's a 1 in 2 chance.
Oh, my word.
So let's get a pillow with the sheet on. Of course, asepsis is quite important, which is what I'm trying to do here. Clean up that area of all the bugs. While that is drying, let me get some syringe as well. What does it feel like?
Really numb sometimes. There's a pain all the way up your arm, and sometimes it goes away if you're relaxed. While I'm at work, then it's always there.
Okay.
Like now I can feel the numbness when I do this.
I'll use a very small needle for you. Sharp scratch. Are you okay?
Yeah.
Good. Let's go for it then, shall we?
Yeah.
You might feel a bit pushed there.
Oh.
Sorry, it might hurt a bit.
Oh, my God. I can feel my fingers tingling.
The tingling is the area where the nerve is. So
I can feel it,
yeah. Okay.
All right.
And I'll call you back in 2 weeks' time. Okay?
All right.
All the best. Take care.
Thanks very
Bye-bye.
much. Bye-bye. Thanks.
Anybody do anything spectacular over the weekend, or is it?
Did all my packing ready for my holiday.
It's all right. So jealous now. Everyone's going away. I'm like, oh. Whereabouts are you going?
Going to the Caribbean.
Oh, nice. What part?
We're sailing from Southampton, doing 6 islands in the Caribbean, and then sailing back.
It's all right for some, isn't it?
Mrs. Ibrahim, please. Please come on in and have a seat. I'm Dr. Bolger. How can I help today?
I've been about 2 to 3 weeks now. I'm struggling with some dizziness.
Has this ever happened before?
No.
No? OK. You've never gone, as it were. You've never fainted or passed out.
I have in the past, but it's been a good 5-6 years since it's happened.
So every day you feel it?
Most days,
Most
yeah.
days. When it started, it didn't start with a cough or cold, no earache, wheezes,
No,
sneezes?
waking up with quite numb hands. I had that after having my first baby as well, and I think it's the constant sitting. I'm breastfeeding, by the way.
Right, OK. Do you think it's positional?
I'm not sure because it's getting worse.
OK.
To the point that this finger's causing me a bit of discomfort. So I'm not sure.
I'm obviously more scary than our healthcare assistant. I mean, that's perfectly normal. It's absolutely fine. OK. I think it would be worth just running a few blood tests, yeah? The things that we would check, the obvious one is iron in someone who's been pregnant and also who's breastfeeding, yeah?
Okay.
And we will just do your blood count and your ferritin levels.
Okay.
Your pulse and blood pressure are absolutely fine. So it may well do what it's done before, which is just melt away, and of course that's great. Yeah, but what we'll do first off is we'll run those tests. Regardless of the blood tests, if it's still persisting, and certainly if you're getting new symptoms, we'd like to see you again.
Yep. Thank
Anything
you very
else?
much. No, that's all.
Perfect.
Nice
You take
to
care.
meet you.
And you. Bye-bye.
So when you say you had blood, when did that happen?
Yesterday, yeah.
Yesterday. And that was blood when you opened your bowel?
Yes, it is.
Yeah,
Yes, actually,
okay.
yeah.
And how have your bowel habits been over the last few months?
Very good, actually.
Yeah?
Well, I mean, my stomach sort of it plays a tune for me, you know.
Okay.
Just-
All right. Yeah. Okay. When you noticed blood, was it mixed in with your stool, or was it just when you...
It was mixed in with a very soft...
Stool.
Yeah.
Okay, okay.
Stool.
And was it painful when you passed that motion? Or?
Painful, it was, well, because it was very, almost liquid.
Liquid, okay.
Form.
Okay.
It was too easy.
Right.
I almost didn't make the toilet.
Okay.
But now, I've just had this morning, and no problem.
No problem, okay.
So what am I, wasting your time?
No, not at all. And you've had some problems with your prostate in the past, I understand. Is that right?
Prostate, yeah.
Yeah?
Yeah.
Okay. What I'd like to do is examine you, okay, to feel your tummy, but also to do examination of the back passage as well today. Is that going to be okay?
Well, it's clean enough. I mean, I'll
Yeah.
give it a good wipe this morning.
Okay.
Okay, doctor.
Yep, all right. Is it okay if my colleague comes in as well?
Yeah, well,
Yep.
yeah.
If you need to lie on your back, actually, sir.
Oh, on my back?
Yeah, on your back. Yeah. So maybe I didn't explain that properly. There you go. If you find this too painful, you let me know, okay? Okay, I'm all done. So you get changed in your own time.
Right, thanks very much. How is the prostate, by the way?
So the prostate feels smooth, but what I think we do need to do is find a reason why you had the bleeding. So I think really what we ought to do is refer you for a camera test in the back passage, where they make sure that there isn't anything more worrying going on inside the bowel to cause bleeding. That's usually done in a clinic where they see people who we suspect might have something like a cancer in the bowel, and they usually see you within 2 weeks. Yeah,
Right, thank you
is that all right?
indeed. That's one.
Okay.
Thank you.
All right, no worries. You're doing very well for
Is
75.
one going to be here tomorrow? One never knows.
All right, nice meeting you, sir.
And you too. Thanks very much,
See you
Doctor.
later. See you later.
You had your hair done? No. Looks as if it's a different colour.
Needs doing.
I'm having mine done. Ready for my holiday.
You can go off people, can't you?
Yes.
Ready for my holiday.
Oh yeah, I'm not envious of our holiday.
No.
Would you not go to the Caribbean?
Not on the boat, I wouldn't know.
Why not?
The thought of sleeping in the middle of the ocean, I just don't. No. I don't like that.
Hi, Denise. Come through, come over to see. No trouble, thank you for waiting. How can I help today, Denise?
I've been coming here with my foot. I was told that I have plantar fasciitis. I feel at the point now I really can't go on any longer. The pain is there every day. It's like I'm walking on an open wound. That's how bad it is. It's, I need some further investigation.
That's sore if I'm pressing.
Shall we crack on?
The back pain, obviously not good.
My son called an ambulance. Pain was that bad. It's painful.
Very. When I do this, I can feel the bits moving inside. It's really painful, so much so that, I can't lift the teddy bear up.
Wow. So that's quite significant pain then. Okay.
I'm not going to do anymore.
Point to the place where you're getting the most pain.
Right, the pain is around this area.
Yes, okay.
Sometimes it comes up to the back here. Sometimes it's all along here.
And what have you been doing for the plantar fasciitis?
I've seen the podiatrist.
Yeah.
I've had some insoles.
Yeah.
And exercises.
Which exercises?
Stretching the calf muscle.
Such as?
And I stand and face the wall.
Yeah.
And stretch the back of the calf muscle.
How many times a day are you doing that stretching?
I say about 10 times.
Denise, I had this myself. Okay, I had this myself, and it is very painful. It is worse in the mornings.
It's worse when I get out of bed.
Exactly.
I can't really walk.
Yes.
And I'm on my feet all day long when I'm working.
The plantar fascia is a thick fibrous tissue that sits at the bottom of the foot. And plantar fasciitis is when damage occurs to this fascia where it connects into the heel, causing, in some people, incredible amount of pain. There are many different measures that we can use to help get the patient better. We initially try conservative measures such as weight loss and painkillers. Stretching and exercises are very important, and there are other options which include orthotics, shockwave therapy, and injections.
The absolute best treatment for this is the exercises, okay? The one that you're doing against the wall is excellent, okay? So you put your hands against the wall, you put your left leg back, and you stretch out the leg, okay? The other thing that you can do is stand on the bottom step, you lower yourself down, and then you bring yourself back up. Really important to stay on the bottom step because I don't want you falling from the top step down. Does that make sense, okay? Okay, what I'm going to do is I'm going to give you an information leaflet on this. What it does is it goes through the exercises that you need to be doing. There we go. So have a read of that. Let's get you better.
Thank you so much.
No trouble, no worries, Denise. Bye-bye now.
Zane, hi, come through. Hi, I'm fine, how are you? Zane's here for his preschool boosters. Does he know what he's here for?
Yeah, he's not really happy about it though.
No. So he's here for 2 in today. So it will be his second MMR and his booster of his tetanus, polio, whooping cough, and diphtheria. So it's got 4 in it. Okay, so it's 2 injections, 1 in top of each arm.
We're ready for it, aren't we?
Are you going to be a brave boy? Are you going to be the bravest boy I have in here today? Oh, brilliant. So if we put his hands, I pull these up. Sorry, sweetheart. I know you don't want to have it,
You said you were going to be brave.
I want you to be a brave boy. Some of them are worse than this, don't worry. It's all right, Zane. I know. You believe it's going to be worse? Good boy. Oh, well done. That's the first one. Good boy. That's the first one, Dad.
One more.
One more. Good boy. Nearly done. Just stay still. Good boy. Good boy. All done. Just a little bit. There you go. All done. Mum needs some. I think Mummy needs a sticker as well. So which one do you want? You choose which one you want. You want the big one?
And this one.
Where are we going to put it? On here or on your top? Other top? Should we put it there? Do you want? There you go. Mummy's got a sticker. You were very brave. There we go. There's your book.
No more.
All done.
Thank you.
That's all right.
Have a good day.
Thank you. Take care. Bye, Zane.
It's not your friend now.
Bye.
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 Okay, how can I help?
Right, can I book an appointment for my son? He's 6 weeks old, so is it 8 weeks for the...
8-week checkup. Is little one behaving?
Yeah. It's just the dad that's not.
Oh, bless. Is it your first?
No, I've got 11 kids.
How many?
11.
11?
Not off the same mum, thank God.
I thought having 2 was bad enough.
Carol Dixon, Carol? Hi, Carol.
Hello.
Morning. Thank you for waiting. Come through, come and grab a seat, Carol. How can I help today, Carol?
I just don't feel right at all. I've had this terrible headache for 2 days here.
Okay.
Then it goes to the back.
Yes.
Then it goes to the side.
Yes.
Well, I am on blood pressure tablets, but I don't know if it's anything to do with my blood pressure.
Yes.
And also, I keep getting these dreadful sweats.
How long has this been going on for now?
Oh, I've had this a few months now.
The sweats?
Mm.
Okay. With the headaches, you said it's been 2 days.
2 days now.
Do you suffer with headaches usually?
Not really, no.
Okay. Has it settled down now?
It's settled down, but I feel lightheaded.
Any dizziness?
No.
Any vomiting? Loss of consciousness?
No.
Any visual disturbance? Weakness, numbness, pins and needles?
Well, pins and needles I've had terrible in my hands for months.
That's been going on for months as well.
Oh, yeah, absolutely.
Eating, drinking well?
I'm not eating like I used to eat.
And mood, Carol, how's your mood been?
All up and down.
Recently, has it been more up or more down?
I get upset very quickly.
Okay. Anything in particular that makes you feel upset?
No.
Hello, young man. Wet and miserable out there, isn't it?
Yes, very.
Right. Now, what can we do for Cody?
Well, basically, I'm here to see if there's any chance that you'd be able to refer him for me.
Because?
Because he's, for the past God knows how many months, he's constantly got diarrhoea. I could change his nappies as much as you'd change a newborn. My nephew's got celiac disease.
Right.
So's my uncle.
Right.
My brother had milk intolerance when he was born.
Yep.
So I was just seeing if maybe there's a way of testing him, if any chance it could have been
Related to an intolerance, yeah. It's certainly possible. There's a long history of people there with it, isn't there? Is he putting on weight and stuff?
He's only 25 pounds.
So he's not...
He's
not
very
as
little,
elevated,
yeah.
Okay. And does he seem to sort of get irritated by actually having wheat products like bread
He
and
refuses
stuff?
to eat.
Or... So he's refusing to eat it really, is he,
Yeah,
as well?
it's literally, he'll just throw his food. If he does, he'll literally just not
Is he still having milk or not?
Milk, he's not having it as much, but sometimes I can give him like tea or maybe a hot chocolate or something like that.
Yeah. Celiac disease is an inflammatory condition of the bowel where the body attacks itself, caused by the gluten sensitivity that they have. It's not an allergy and it's not a food intolerance. Children with celiac disease get very similar symptoms to adults, such as the stomach pain, diarrhea, and sometimes blood in the stool. If celiac disease isn't treated properly in a child, they may be failure to thrive, where they don't grow properly, and if it becomes very severe, they may not reach puberty when they should do. If it's treated properly by removing gluten from the diet, then none of those things will happen, and they can lead a normal and happy and content life. I mean, it's possible that he's intolerant to any of those sort of things, and normally what you do is try and exclude it with this group and then see.
Yeah.
I think because you've got sort of quite a long family history of various things, and he's underweight, it might be worth then just sort of seeing one of the paediatricians with a view to perhaps looking at doing some...
Yeah, that's fine.
Does that make sense?
Yeah.
Yeah? Otherwise, you're happy with his development and everything?
Everything else is fine.
Fine, yeah? Yeah, you look bright and alert. Good. Well, I'll drop them a line with a view to sort of looking at testing for all of those conditions. Okay.
Yeah, that's fine.
All right.
Yeah. Okay, that's brilliant.
Okay.
Thank you.
Righty-ho. Here, so I'll grab that door.
Thank you.
You
Come
can
on
get
in.
out.
Come on in.
Bye.
Thank you.
Okay, take care.
And you. Babs, come here.
I think my finger's gonna fall off.
Sorry?
I think my finger's gonna fall off.
Your finger?
Yeah, I shut it in a chair.
You mean your fingernail?
Both.
Do you want me to get a doctor to cut it off for you?
No.
Dr. Jiwanji's really good at amputation.
I just can't feel the end of it. I squished it.
You've squashed it, have you? Oh.
How long have you been feeling like this for?
Oh, quite a while.
A few months, few years?
Well, I'd say about the last 9 months.
Anything in particular that changed over the past 9 months?
Yeah, I've got a friend whose husband died of Parkinson's. And I've been going, I feel so stupid.
It's okay, you've definitely got nothing to feel silly about.
I've been going up there nearly every day. And it's just sort of got me down a bit.
Have you had any help and support? Carol, I'm glad you mentioned it, so we don't want you feeling down like this, okay? There's lots of things that we can do to help. So there is a support team that we have. It's called Talking Therapy. What they do is they give you the right tools to help lift your mood from down there back up to where it should be. Right? I think those are definitely the people that you should be contacting now.
Can't do any harm.
Absolutely, absolutely. Well, they're there to help. They are there to help. All right, so let's check your blood pressure. Have you taken your blood pressure medication today? Yeah. Okay, Carol, your blood pressure is up today, okay? So what I'm going to do is I'm going to add in another medication to bring your blood pressure down, okay? And I'm going to book you a review tomorrow morning for one of the doctors to recheck your blood pressure to make sure it's come down to a region that we prefer it to be in. Does that make sense, okay? Now, there's lots of things that can cause headaches. One of the things absolutely is blood pressure. Sometimes that can cause headaches. The other things, you know, when people are feeling down and very stressed, that can cause headaches as well. Does that make sense? So we need to get both of these things sorted in your case.
There we are.
Lovely.
So, Carol, take your medication.
Yeah.
And I'll see you tomorrow morning.
Oh, sorry about that. I feel so stupid.
Definitely nothing to apologise for.
Yes, lovely. Thank you very much.
No trouble, Carol.
Oh, I have to watch how I get up. I'll go
Yes.
slightly giddy.
Okay. So let's see you tomorrow morning.
Thank you.
All right.
Bye-bye.
Bye-bye now.
Mrs. Notley, hi. Come in, take a seat. I'm sorry for the wait. So, you're out of puff?
I'm out of puff and my knee's playing me up. I meant to have mentioned that. Look at this.
You've got arthritis, haven't you, in that knee?
Something in it.
You have, yeah.
I want a new pair of legs.
You are a candidate for a new pair of legs if you want a new pair of legs. That's very clearly arthritis going on in that knee, and possibly reach the point that you would need a knee replacement. Would you consider that?
I've had one done.
That one?
That one, yeah.
Would you consider having the other one done?
Yeah, how long's it going to take?
Yeah.
You know, that's the waiting list, isn't it?
Yeah. We could get Dr. Wood to put a steroid in it.
What's that?
A steroid injection into the knee. It tends to settle the pain down.
Yeah.
Should we do that? All right, OK. So for that, that's a quick fix. I can get Dr. Ward to do that. You're really out of puff.
I know.
I'm trying everything to try and get that off, but no matter how much I get off, it keeps coming back constantly.
They're very dry, aren't they? Why are your hands this colour?
I just put the yellow powder a little bit.
What, turmeric?
Yeah.
You've put turmeric on your hands?
Yeah.
And I have noticed recently that she scratches herself a lot,
Really?
to the point where she makes herself bleed.
Oh, bless her.
If I pull my head over,
Yeah.
shake it,
Yeah.
it's a snowfall.
So almost dandruff type.
Yeah, but
Lots of
more
flaky,
itchy,
dry
yeah.
skin.
There's no bus anymore. I had to get a taxi here. Cut our bus out totally. There is no transport whatsoever.
When did that happen?
About 3 weeks ago when they first did the new bus routes.
Yeah.
No bus whatsoever. How can you do that? Not be able to get to... Anyhow, never mind, you're busy. Look, while I came, I've had 3 lots of antibiotics. Now, because most of them were done over the phone, obviously they couldn't see it. But the last time I saw a doctor, he wasn't a skin doctor like you. Now, it's just like going to the dentist, it's cleared up now. But I just want to show you where it was. I keep getting this cellulitis, which probably happens with the scratching and the cracks in my feet. And I've had 3 lots of antibiotics, which I didn't like taking. First of all, see, I get it here. That's where I always get it. Then it spread. I had it across here, all round there. But the worst thing was here. This went all like orange peel, went mauve, and it was puckered. Do you know what I mean? All puckered in here.
Yeah.
And it was like when I walked, like elastic band round my leg, shooting pains up my legs, and the pain was excruciating.
How are you? How are you? Nobody yet?
Yeah.
Long time?
Yeah. Still a swing.
Let's have a listen, see what's going on. Can you zip that up?
Yeah.
You've got really fine crackles all over your chest. Can we check your blood pressure? It's really playing up today, I don't know why. Let me do it the old-fashioned way. Gets serviced once a year and it keeps on going.
That's what I mean, see? All this modern technology. I don't believe in it. Give me the old-fashioned ways any time.
Blood pressure's up a bit. We're going to repeat the chest x-ray because we know that's a bit odd anyway. You've always got scarring in your lungs. I'm tempted to increase your water tablets because I think there's some fluid on your lungs, and see if we can take that off and get you less breathless. And I'll see you again in a couple of weeks and see how you're getting on. Okay? Is that all right?
Yeah.
Pop down for your chest x-ray. we'll take it from there. Okay? Okay. All right, we'll see how you get on. Obviously, in the meantime, if you get worse, please come back and see us. Don't soldier on at home. I know you like to soldier on. Don't soldier on.
I'm not one for doctors and...
I know that.
One bigger than the other.
I know that, but then, do you know, things do go properly wrong with you, and then we need to know. All right, take care of yourself.
Okay.
All right, bye. Have a good weekend.
And what was it, diarrhea for how long, sorry? 3 days. Right, OK, I'll put that down for you. OK? Thank you, bye. Oh, how do you spell diarrhea? Dio.
You're asking the wrong person.
It's such a hard word. I'm going to Google it. Oh, I've definitely spelled that wrong.
Do you ever think that? It's a good thing you've come today, actually, because there has been sort of another product that's come into use, which is for psoriasis.
The trouble is, Dr. Shri, I can put up with the hard skin, I can put up with the cracking, everything. It's the itching. It's unbearable. I can't sleep at night. I wake up 3 or 4 in the morning with the itching. It's so bad. What is it, though? A cream or a...
It's kind of like a mousse.
Literally, I could scratch until I ripped my skin.
It's always been one of the things that I think has most irritated you about this, isn't it? So I will...
My God, they're running late out there. I think it's only you, isn't it? See, you shouldn't be so popular.
No, it's not that. I think we're closing
too nice.
Monday.
I'm telling you, you're too nice. Because where most doctors, they sort of just chuck you out, you know, and you chat. Oh,
That's
yeah.
not what I've seen.
Yeah, some of them do, I can assure you.
There are times when we do have to run late because the problems just cannot be done within 10 minutes. But there are also occasions where, you know the struggles, like, for example, who've had to come in all sorts of ways to get here because your bus routes changed, means that, how can I say...
Non-existent. It's disgusting. How you can leave a whole community of people stranded, unable to get to the chemist or the doctors or public transport.
So that's the new foam. You have to physically rub it in.
Oh, I'll try anything.
Might be
Let's
worth
face
it.
I've tried everything else. I didn't like taking all those antibiotics.
This obviously is not a tablet, so hopefully you won't have any problems. OK, good.
Yep.
Nice to see you. Take care.
Lovely seeing you as always.
All right.
Bye-bye.
Have a good day. Bye-bye.
Thank you so much.
That's all right. Have a lovely day. Lovely to see you.
OK, thank you. Bye-bye.
Bye-bye. All right. Bye-bye. Bye. Bye.
All right, my darling. See you later.
I'll see you next week. You have a beautiful day.
And you.
Bye. Give me a high five. Brilliant.